Good afternoon, and thank you for joining the Connecting to Chronic Care Management Services Partner webinar. This webinar is hosted by the Centers for Medicare and Medicaid Services Office of Minority Health and the Federal Office of Rural Health Policy at the Health Resources and Services Administration. We have an exciting agenda planned for today. During this webinar, we will provide an overview of the newly launched Connected Care, the Chronic Care Management Services Resource Initiative, designed to educate healthcare professionals and consumers on the benefits of chronic care management services. This webinar is intended for national, regional, and local organizations interested in learning more about the Connected Care Initiative and CCM. It is not intended for the press, and remarks are not considered on the record. If you are a member of the press, you may listen in, but please refrain from asking questions during the Q&A portion of today's call. If you do have inquiries, we do want to hear from you. Please contact CMS at press@cms.hhs.gov. To go over a few logistics, this webinar will include a question and answer segment, and we want your input, so please participate. It's a discussion. Feel free to share questions and comments in the chat window on the right side of your screen. We also have access to real-time transcription of this event, and you can see the bit.ly there. If you have any technical issues, please contact GoToWebinar at 855-352-9002. And now it is my distinct pleasure to welcome our speakers for today. Dr. Kara James, Director of the CMS Office of Minority Health, and Mr. Tom Morris, Associate Administrator for Rural Health Policy at HRSA, will provide opening remarks that help to show the significance of chronic care in our country, as well as the Chronic Care Connected campaign. Michelle Oswald, Program Manager within the CMS Office of Minority Health, will provide an overview of the Connected Care Initiative to present its purposes and resources. She will also explain how organizations such as yours can partner to help promote the benefits of CCM. We'll also hear from some of our partners, Carla Isley and Lori Weber from Noridian Healthcare Solutions, and Stanberry from TMS Health Quality Institute. We may also hear from another partner from the Albany Area Primary Healthcare, Clifton Bush, and we'll be giving brief presentations to share stories from the field and resources that you may find beneficial for CCM. I will now turn the webinar over to Dr. James.
Thank you, Monique, and thank you all for joining us here today on this exciting day as we're kicking off our Connected Care, the Chronic Care Management Resource Initiative. We at the Office of Minority Health here in CMS are very excited about this opportunity because as we work to ensure that all of our CMS beneficiaries have achieved their highest level of health and disparities are eliminated in access and quality of care, focusing on chronic conditions and what we can do to ensure chronic care management is an important part of that. And as we're going to talk about the focus of today, we know that 7 in 10 of the top causes of death are chronic diseases. And people with chronic conditions account for more than 80% of our national health care spending. When we look at our Medicare population, we know that 2/3 of our Medicare beneficiaries have 2 or more chronic conditions. Many of these individuals disproportionately burdened are people of color and those in rural communities. And it's one of the reasons why today is such an important point as we are officially kicking off our Connected Care campaign, as we want to educate healthcare professionals and consumers about the benefits of chronic care management for Medicare beneficiaries living with 2 or more chronic conditions. And we're excited in partnering in this endeavor with our colleagues at the Federal Office of Rural Health Policy at the Health Resources and Services Administration as we embark on this to help our particularly vulnerable populations benefit from chronic care management services. And I want to thank our speakers for providing that on-the-ground perspective and our partners about what they are doing to help provide ideas for you about how you might embed some of these resources and services into the communities and populations that you work with. So without further ado, I want to turn it over to Tom Morris, the Associate Administrator of Rural Health Policy at the Health Resources and Services Administration. And again, thank you all for your participation today. Tom?
Thanks, Kara. I couldn't agree more with your points, and I really want to thank you and your staff for the partnership in this effort. We really are really happy to be part of it. It's my pleasure to be the Director of the Federal Office of Rural Health Policy, and in that role, we're charged with advising the Secretary of the Department of Health and Human Services on healthcare issues and how they affect rural communities, including access to quality healthcare. I think as many of the folks on this call likely know, rural communities face some real challenges in terms of access to care. We know that rural areas tend to have higher rates of chronic illness and poor overall health when compared to urban residents. Folks from rural areas tend to have fewer healthcare providers, harder to find clinicians to practice out there, and they often have to travel a greater distance to get that care. I don't think it's any surprise that these factors likely play a key role in what we're seeing as a growing disparity in life expectancy for rural America compared to the folks in urban areas. And that gap has grown considerably in the past 20 years and appears to be growing based on the most current data. So I think whether we're talking about heart disease or lung cancer or stroke, it's just a fact that rural residents face some real challenges in terms of addressing those conditions. And that's why we're excited about this campaign and the opportunity to work with the CMS Office of Minority Health, because I think we're going to have the opportunity to bring some important attention to this issue and hopefully turn some of these metrics around. I believe that the Connected Care campaign for chronic care management is going to be particularly relevant for rural communities because of what we know about the demographics out there. And it will also be important not only for the patients, but also for the providers who serve them. The implementation of chronic care management services by physicians and nurse practitioners, physician assistants and nurses in rural areas working in these communities, I think it has the potential to really not only educate rural residents about things they can do to better manage their care, but I think that it's going to also help rural providers take advantage of a number of new tools, some billing codes that you'll hear more about, and other initiatives that CMS has underway that I think are going to make a real difference moving forward. So we're looking forward to the next steps on this campaign and really leveraging this on behalf of rural and underserved communities. And so with that, I'll turn it over to Michelle.
Great. Thank you so much, Tom. My name is Michelle Oswald. I'm with the CMS Office of Minority Health, and I'm going to talk to you today about chronic care management services and our new Connected Care campaign. So what is chronic care management? Chronic care management is defined as services provided by a physician or non-physician practitioner and their clinical staff per calendar month for patients with multiple chronic conditions expected to last at least 12 months or until the death of the patient. Chronic care management is person-centered and requires more centralized management of patient needs and coordination among practitioners and providers. In 2015, Medicare began paying separately under the Medicare Physician Fee Schedule for chronic care management services furnished to Medicare patients living with multiple chronic conditions. CMS first established payment for CPT code 99490 to pay providers for at least 20 minutes of clinical staff time directed by a physician or other qualified healthcare professional per calendar month. CMS has been working to make rule changes that enable separate payment for more complex and time-intensive chronic care management services, as well as reduce administrative burden by improving alignment with coding language, simplifying the patient consent, and reducing documentation rules. With that, in January 2017, CMS added separate payment for 3 additional billing codes in response to feedback from healthcare professionals across the country. So today we won't be going into detail on chronic care management services and requirements, but there are fact sheets and frequently asked questions available on the CMS Care Management page at www.cms.gov. If you click on the search engine and type in chronic care management, those fact sheets will come up. You can also send your technical questions to ccm@cms.hhs.gov or go to our website go.cms.gov/ccm to view our past webinars. Today I'm excited to talk to you about a new initiative that we are launching around chronic care management called Connected Care. Connected Care was developed by the Centers for Medicare and Medicaid Services, Office of Minority Health, in partnership with the Federal Office of Rural Health Policy at the Health Resources and Services Administration. It is a national public education initiative that seeks to raise awareness of the benefits of chronic care management services among healthcare professionals and patients, particularly in rural areas and among racial and ethnic minority populations. The Connected Care campaign has two primary audiences. The first are healthcare professionals, particularly physicians, clinical nurse specialists, nurse practitioners, certified nurse midwives, and physician assistants, but also ancillary and support staff. This also includes rural health clinics and federally qualified health centers. The second audience are consumers, specifically Medicare beneficiaries, as well as those who are dual eligible for both Medicare and Medicaid with 2 or more chronic health conditions. Through Connected Care, we will place a special focus on reaching underserved rural populations as well as racial and ethnic minority populations. The Connected Care campaign is a national initiative, so we are striving to reach every state, but we will have a targeted focus in 4 states. Using Medicare claims data, CMS identified 2 markets within each of those 4 states, 1 rural county and 1 urban area, to implement localized campaigns with the support of CMS and HRSA regional offices and partners such as yourself. Target markets were selected on a variety of factors, including Medicare enrolled beneficiary data, existing use of chronic care management, the prevalence of 2 or more chronic conditions, as well as the adoption of electronic health records. The campaign includes a mix of outreach approaches, including paid and earned media, social media, partnership development, and patient and provider education. We have developed a comprehensive information hub on the CMS OMH website that provides links to our suite of chronic care management materials available to download. The Connected Campaign Initiative is officially launching today and will run through the end of July of 2017. We will implement a variety of different communication activities during each month of the campaign, and all of these activities will be pulled together and support a report to Congress that's due in December 2017. We are very excited about the enhancements that we've made recently to our Connected Care website, go.cms.gov/ccm. Our goal is for this site to be a one-stop shop for chronic care management with all of our new products, as well as links to chronic care management resources, including the existing CMS Care Management page, CM fact sheets and FAQs, and information on our upcoming CCM webinars and events. As part of the initiative, we are offering some new resources for healthcare professionals. One of those resources is a web-based toolkit that is now available to download as a PDF on our website. Some items included in the toolkit include guides to getting started with chronic care management and how to talk to your staff and patients, materials that explain what chronic care management is, who it's for, why it's beneficial, and how to bill for those services, as well as links to other resources, as well as examples of sample CCM materials. We also have a testimonial video that's coming soon, which will have healthcare professionals sharing their experience with implementing chronic care management programs. Educational materials are also available to share with patients, to include a patient flyer and a poster, which we will talk about on the next slide. We've created educational materials that can be adapted for physician practices and shared with your patients. We have in-clinic posters available to display in doctors' offices, as well as postcards that can be shared with patients, all highlighting chronic care management benefits. We are also finalizing an animated video for patients that explains the benefits of chronic care management services that doctors can also play in their offices. Again, these materials are all available to download at go.cms.gov/CCM. And if you are interested in ordering materials, you can email us at ccm@cms.hhs.gov. Partnerships are very important for this initiative. We encourage organizations such as those of you on today's call that represent healthcare professionals, health systems, rural clinics, community health centers, patients, and organizations serving racial and ethnic populations, as well as caregivers, to reach out to us and get involved at the national, state, and community levels. For our partners, we now have a partner toolkit available on our website. This toolkit is also web-based and available on our website to download as a PDF. The toolkit contains suggested activities that we hope will be useful for all types of groups who talk to healthcare professionals and consumer audiences. It was designed to make your job a little easier to get information out about chronic care management. In the toolkit, we provide suggested ideas on how you can spread the word, to include publishing a newsletter article or a blog post, or sending a blurb in a newsletter or email listserv. We will also have social media resources such as sample Facebook posts and tweets, along with graphics coming soon. Each of these will be offered in both English and Spanish so we can reach a wider network of consumers and partners. Here again, you can see some of the ways that you can share the resources and chronic care management information through your existing communication channels. So we hope that you will join us in making this initiative a success.
Thank you very much, Michelle. Now I'd like to introduce Carla Isley. She is the JF Project Manager at Noridian Healthcare Solutions. Carla?
Thank you so much. This is Carla Isley, and with Noridian Healthcare, we appreciate the opportunity to collaborate on the Connected Care Chronic Care Management campaign. Noridian Healthcare Solutions is the Medicare administrative contractor for fee-for-service or traditional Medicare in the state of Washington, one of the 4 pilot states identified in Michelle's earlier slides. We're very excited to support this campaign, and we have resources on our website that Lori Weber, our Provider Outreach and Education Representative, will briefly go through at this point. Thank you. And I'll turn it over to Lori.
Well, thank you, Carla. Now, I would like to let the attendees know, as the MAT contractor, Noridian is continuing our dedication to educating the provider community. We have been presenting CCM webinars since the original implementation in 2015, and with the 2017 updates, we just most recently had one last month in February. If you were not able to attend that presentation, we will have another one in May, and we'll have all the information posted in the next week or so. This is all located in this link shown here, and what we'll cover and what we have been covering is a few slides on the CCM overview and what services are involved, the highly anticipated 2017 updates that assist providers and add additional codes that have already been discussed, who is eligible, both the providers and Medicare beneficiaries, what needs to be met for the provider's scope of service, how to bill and document properly, and lastly, valuable resources and other generic useful information. And then we should have our website updated, as I just talked about, and providers will be able to browse by topic for the CCM. Noridian is also finalizing recordings under self-paced trainings, and these will consist of a 3-part series. Provider education will continue with quarterly webinars, so if you missed that one in February, like I said, our next one's in May. We will involve as many medical and specialty associations to communicate and promote CCM as well. Lastly, if you're in a Meridian state, please sign up for our listserv, which are our biweekly emails to keep on the cutting edge of these promotions and updates. And thank you.
Thank you very much, Carla and Lori. I now want to introduce Ann Stanberry. She is the Project Director for Immunizations and Chronic Care for TMF Health Quality Institute, and she will share TMF's experience with recruiting and helping clinicians implement CCM services within their practices. Ann?
Thank you very much for inviting me to speak today. I'm Ann Stanberry, and I'm with the TMF Health Quality Institute. We're the Quinn QIO, and we cover a five-state territory area. And we're under contract with CMS to provide quality improvement services to all of the providers that we work with. We work with a wide variety of providers, hospitals, physicians, home health agencies, long-term acute, and other providers as well. The geographic area we cover is Arkansas, Missouri, Oklahoma, Puerto Rico, and Texas. In September, we received a 2-year contract from CMS for a special innovation project to work with providers to actually implement chronic care management services. And our goal has been to recruit and work with at least 100 clinicians in Arkansas, Oklahoma, Missouri, and Texas. I'm pleased to say right now that as of today, we have recruited at least 100 clinicians, and we're still recruiting. And our job with them is to provide one-on-one virtual and in-person technical assistance to help them understand how to implement CCM services. In addition, we're providing educational webinars, tools, and resources. We have a website as well. Next slide, please. So how we're helping our recruited providers, as I said, we're doing technical assistance. We're helping our providers identify their eligible Medicare fee-for-service beneficiaries who may qualify for chronic care management services. One of the big pieces of what we're doing is walking through with practices what their workflow processes are to help them see how CCM can fit into existing workflows or with slight modifications to workflows that they can start using CCM services. We work with them on billing requirements, identifying staff to deliver CCM, how to enroll patients, how to use telehealth. We're doing regular educational webinars on CCM and, of course, publicizing all of the wonderful CMS webinars that are being offered. We have provided a number of tools for our providers, like patient letters, care planning documents, contact tracking logs, implementation checklists. One of the things that you'll see on the next slide is a picture of our CCM website, where we have our toolkits and resources and all of our educational events posted. And so you can see this is what our chronic care management landing page is. It's part of a larger learning and action network that TMF offers that includes all of our quality improvement projects. If we go to the next slide, please. Anybody who's interested is free to have an account at our website, which is www.tmfquinn.org. Once you have registered, you'll be prompted to join the networks that you're interested in, and we invite anybody who's interested to join our chronic care management website. And this is our contact information if anybody is in our geographic area, which is Arkansas, Missouri, Oklahoma, and Texas. We would love to hear from you and help you in any way possible. Thank you very much.
Thank you very much, Ann. And now I want to turn it over to Clifton Bush. He is the Chief Operating Officer for Albany Area Primary Health Care, and he'll share what his organization is doing to support CCM in his community. Clifton?
Hey, good afternoon. How is everyone? Can you hear me?
Yes, thank you, Clifton.
So I'm Clifton. Thanks. I'm Clifton Bush from, again, Albany Area Primary Healthcare. And just to give you a little bit of background about our organization, we are a federally qualified health center located in southwest Georgia. We cover about 7 counties, and we have different disciplines within our organization, such as primary care, OBGYN, dental, podiatry. We have an HIV program, and as well as school-based health centers. So we have 25 clinical sites and with 27 actual buildings within our organization. And so just to get to the chronic care management, what our organization, how we started chronic care management is that we actually started with a nurse practitioner that she actually had got sick and couldn't work as much as in the clinic anymore. And so it was the ideal time when chronic care management had came out for federally qualified health centers that we started with her. And so she would actually see patients in the clinic, and then she would help along with the nursing staff and the support staff within the clinic as far as, you know, introducing chronic care management to the patient with different flyers that we utilize for marketing and also, you know, just by word of mouth informing the patients about the program. And so she would get them signed up and make sure that they had the annual exam that the patient needed. We work with eClinicalWorks, which is our electronic health record system, and appropriate individuals within our organization, which included me and our insurance manager and the nurse practitioner that was helping to get this going, got together and looked at the chronic care management module that was inside of our electronic health record and practice management system. And so this module that was in our EHR system actually helped the nurse practitioner with time, the appropriate amount of minutes that, you know, she talked to the patient. It actually would send the information to the insurance company through the clearinghouse for the bills, you know, the claim to go out to the insurance company. And so we liked that module that the EHR system already had, and so we worked with eClinicalWorks in order to implement that module within our organization for the nurse practitioner to be able to do the chronic care management with the patients and actually send the claims with appropriate code off to the insurance company. And so our electronic eClinicalWorks also had different, again, marketing tools that we could use. They also already had like a consent form, example consent form that was approved to use for chronic care management. And so we kind of tweaked the consent form and used some of their marketing that they had and, you know, tweaked that to fit our organization. One of the things that we did find out when we got started with the chronic care management within our organization is just making sure to notify patients about if they have, you know, they may have a copay from some of the, you know, like Advantage plans, et cetera. And so, but the patients enjoyed it very much. The patients actually liked afterwards that the nurse practitioner was contacting them to follow up on, you know, their asking them about their medication, all the education that she was giving them, you know, from their visits, and just making sure that they're doing well, et cetera. And so we had a lot of patients that, you know, would talk about how much they enjoyed the program. And so currently we will be looking at spreading this program to other clinics within our organization. But that's the gist of how we started chronic care management and kind of what we're doing now, and you know, how the enjoyment from the patients on the program. Any questions?
Thank you, Clifton. We do have one question. How did you overcome any barriers to the informed consent process? What was successful in your community?
So I think what was successful is that the nurse practitioner when because she was actually the one that would be doing it, and she was seeing some of the patients for their visits within the clinic, and talking to the patients about you know, you have to sign this consent form, et cetera, in order to participate in the program, and just educating the patients about the program. And also she informed them that she would be the one that would be doing the program. And I think with her, you know, being, you know, the patients knowing her within that community helped a lot with us.
Another question for you, Clifton. In terms of the copay, how did you handle that, and were you able to identify those who had SSI to be able to support that copay?
Yes, that's something we work with our insurance. We have a good number of insurance clerks within our organization, and are dedicated to certain, you know, payers and clinics. And so they helped us to identify, you know, those patients. As I stated before, we did have some pushback from a couple of patients because of the copay. And that's when we found out, you know, that when we came back to the table, that's something we really need to explain to the patient, if, you know, if they have a copay. And so that's why I was saying, make sure whoever is introducing the chronic care management program to the patient, that it explains to them that they will have a copay. Because we did have some patients that did, you know, say they didn't want to do the program anymore. Majority of them did stay with the program, but there were a couple that did not want to participate because of the copay issue. And so I think by us explaining it up front from the point where we knew we needed to do that, it helped a lot to make sure that the patients understand that. So they could say, I do want to participate, or no, I don't want to participate within the program.
Thank you, Clifton. This question is for Noridian and TMF. Do you provide support if someone has questions regarding a specific reimbursement approach? And can you please share the kinds of technical assistance that you will help provide us with?
Hi, this is Ann with TMF, and we have at times we have answered questions about billing questions. If we're uncertain about how to respond, we've called the MAC on behalf of providers to try to get some additional information, because we're certainly not the final billing source and we don't want to give inaccurate information. And as technical assistance that we provide to the providers that we've recruited, we actually work with them from the beginning of the process, from who their patients are to helping them figure out how to reach out to those patients to recruit them and decide on which staff within their practices are going to be providing the CCM services, what type of CCM services and how often they're going to be providing those to the patients, and then helping them with EHR documentation and any billing issues that they might have.
And this is Lori from Noridian Education, and we will do our best as well to answer those questions about the details of CCM. For the technical pieces, you may have to go to your vendors and make sure that that's all set up, or your clearinghouses. And I might defer to CMS to continue with that, but we'll do everything in our power to help with the coding, the billing, the documentation, everything that we can help with for our Noridian states.
Thank you both. I also have another question for Clifton. Can you share how many patients around about you've been able to enroll in Albany, as well as any other best practices for other people who are helping people on the front lines?
So I think currently we have about 80 to 100 patients maybe enrolled into the program. And so I would just say the best practice that we learned is just to make sure, if you have the opportunity, to make sure to educate, your support staff, the nursing staff within the clinic, or whoever is going to be, talking to the patients before introducing the program, and just making sure that they are aware of the different things within the program, especially anything, for example, like the copays that could be a barrier to them participating in the program. But I would just say the education piece, just make sure that patients are educated.
Thank you, Clifton. The next question is for Michelle. Michelle, are CCM services available in federally qualified health centers and rural health clinics?
Thanks, Monique. So yes, actually, as of January 2016, rural health clinics and federally qualified health centers have been able to bill for chronic care management services for the one particular code, 99490. I will say to keep an eye out for any potential changes or updates to the physician fee schedule, proposed rule changes that may be out late spring.
The next question is also from Michelle. Are you beta testing the campaign in the 4 states mentioned? If so, when will it be rolled out nationally? Can you please clarify?
Sure. So as I mentioned, Connected Care is a national campaign. We are hoping to hit every state with information, but we are specifically targeting the 4 states that I mentioned, Georgia, New Mexico, Washington State, and Pennsylvania, with more targeted outreach efforts.
Thank you very much, Michelle. And if someone wants to become a partner in this campaign, what should they do?
If someone wants to become a partner, they can email our CCM mailbox at ccm@cms.hhs.gov, and also check out our materials on our website, particularly our partnership toolkit, which has all the materials available to be able to support the campaign.
Thank you, Michelle. I know that we're not going to go into many specific questions about billing at this time. However, that email that she shared, if you do have any questions, you can send it to them, to that email, as well as you can contact our MACs who are on the front lines to help providers bill for CCM. There is one basic question regarding whether healthcare practices need to reconsent a patient now that we have the new codes, if they've already consented them to start service.
No, so once you received patient consent, if that was done, well, it was through written consent last year or through oral consent verbally this year, you do not need to consent that patient.
So if a clinic would like to order materials to be sent to their area, I'm getting a question, for example, from Minnesota, what should they do?
You can email the CCM mailbox at ccm@cms.hhs.gov. Please provide your name and mailing address, and specifically how many of each material that you would like to order.
We are getting some questions about helping to support informed consent, as well as what will be included in the care plan. I did want to highlight that we do have on the CCM website a sample healthcare professional toolkit, which answers many frequently asked questions. It has some of the tips to help you prepare a patient to understand what are the benefits of CCM. It also has what are the key elements of a chronic care plan. It's not prescriptive. It is just some of the key elements that you may want to consider in your comprehensive care plan. That HCP toolkit is available on our website, and we do appreciate and acknowledge the questions to support that. We want to encourage you to go there. Also, we have a patient education postcard that you can have in your clinics. You're able to print that out and share it, also to leverage it in your community. In addition, we have some posters if you're interested in prompting your patients to ask for this service. That poster can be downloaded and printed. We also have some copies available here at CMS. So if you're interested in that, please go to the website or you can send us an email. This question is for Michelle. What are the projected outcomes for this campaign? What does success look like?
So success for us, what we would hope to do is be able to reach every state across the nation with materials. We also, although we're not going to relate any particular uptake in chronic care management services, we will be evaluating the initiative and looking at Medicare claims data for the next 6 months and beyond, particularly to see if there's an increase in the use of chronic care management services throughout the country.
Thank you, Michelle. Clifton, we have a couple of questions for you. How is the care coordinator being notified by the hospital, and how do you manage that check-in with the patient so that you can help to connect care and support the transition between a hospital and home and then back to your clinic? What does that look like for you and your community? Okay, Clifton may be on mute, but I did want to share that the monthly check-ins are meant to provide an opportunity to call on the patient to see how they're doing on their medications, to check in on their health, as well as to see if they visited any other healthcare facilities, ambulatory care, emergency care. We are aware that in some communities there is a link between hospital and ambulatory care and the actual practice. In some places that's not. But at least that monthly check-in is an opportunity to follow up on what has transpired since the patient's last visit. This question is for TMS and Noridian. Can you discuss a bit more about the webinars that you're going to be hosting and the kinds of technical information you'll be able to share with clinicians?
Well, this is Lori Weber again from Provider Education, and the one that we'll be providing in May, I'm not real sure what you mean by technical information, as far as we're not going to get into each different practice management system or electronic health records, but what we will do is give you the all of the notifications and requirements that came out from CMS. Some of them have been relaxed, which we're really happy to hear about, and those. What we could do is, if you're in a Noridian state, I would be happy to send you a previous presentation if you want to email me. And I don't know if I should be giving my email out to the whole country now, or if that person, can you tell what state they're in?
We can forward it to you. Thank you.
Excellent. Thank you. I look forward to helping them.
Great.
This is Ann Stanberry from TMF, and we're having quarterly education webinars. Those are all posted on our website, and we deal with things like the CCM billing codes, the scope of CCM services. We're going to be talking about ways to handle patients with multiple chronic conditions and care coordination services in general in upcoming webinars, because we thought that would be helpful to providers. And any of the resources and tools and technical assistance that we offer is posted on the website, and anybody who's interested can join our website and look for those tools and resources. For this particular person, if you have further questions, my contact information is in the presentation, so feel free to give me a call, and we'll see if we can help you more specifically.
Thank you both. The next question is about the languages that the materials will be available in. Michelle, can you let us know if it'll be in any other language besides English?
Sure. So at this point, several of our materials that are provided in the toolkits will be available in Spanish, particularly the healthcare professional information card as well as the consumer cards will be available in Spanish. And then we'll also be targeting some Hispanic populations in particular states that we'll be in, and we'll have some really specific social media information and some of the listserv announcements and other basic information in the toolkits will also be translated in Spanish.
And Michelle, several people are interested in that email again. Can you please repeat?
Sure. It's CCM for chronic care management at cms.hhs.gov.
Thank you, Michelle. We also got a request to go back to our slide on the CCM specific code, so we're leaving this up here for a few seconds for you to take a look at. We've also gotten questions about whether this presentation will be available online. We have posted it actually right now. You can download it from this web chat. If you look on the right box, there is a tab called Handouts. And if you click on that, you're able to actually download this presentation. In addition, we'll be making this audio available on our website, and you can access that and download it. We'll send an email to you when it's all posted. We're doing a quick scan for any additional questions. If there's anything that you would like to ask, please let us know. The next question is, are folks in Puerto Rico able to participate in CCM as well as the campaign?
Thanks, Monique. So yes, if you're in Puerto Rico, you can participate and bill for chronic care management services in Puerto Rico. If you have particular questions, I know that our New York regional office supports the folks in Puerto Rico, and if you want to follow up through email, we can connect you there, and that's ccm@cms.hhs.gov.
Thank you, Michelle. The next question is there a cost to order materials from CMS or even to download them?
So the materials are available at no cost. You can download the toolkits that are online as well as those products. They're available by PDF. And you can also order hard copies, again, through the CCM mailbox, and those are available at no cost to you. Just provide your mailing address as well as how many of each product that you would like to order.
Thank you very much. We've gotten a couple of questions, again, about downloading resources and emailing CMS. We are going to move again to that slide so that you have a chance to take a look at this. Again, if you go to our website, go.cms.gov/CCM, that site will have all of these resources that we're talking about today, and we're going to continue adding to those. Also, if there's something that you feel like you need in your community that we currently don't have, please send us an email to ccm@cms.hhs.gov. So, Michelle, we're getting some questions about what does it mean to be a partner? What kinds of activities are you asking people to get involved in?
Thanks, Monique. So some of the activities are included in the partner toolkit that's on our website. those activities could be as simple as sharing the information with the folks that you work with within your communities, whether it's a healthcare professional or whether you work with Medicare beneficiaries one-on-one. Share the information that we have about chronic care management services. We can also use some assistance if you're interested in presenting in any of the local states. We're interested, we'll have a slide deck available with talking points that you can incorporate into your information if you're going to be at a conference or if you're going to be presenting to folks. You can take and use as many of those to incorporate as you need. And then just share with us the stories that you have if you're having some issues within your region, or if you're talking with Medicare beneficiaries and they bring up some concerns. Please share. Also, I like to hear success stories, so share them all in our mailbox, ccm@cms.hhs.gov.
We're seeing a lot of engagement and interest from various states. We do want to repeat and note that this is a national campaign. We welcome participation from every state in this country. It would be fantastic if you all can get involved. We'd also love to hear about what you're doing. So please send us an email and let us know if you are planning to share any materials and resources in your state and your community. Again, those materials are available for a free download, and it's not a cost to you. You can also email us if you'd like to access them. With that said, I would like to thank everyone for participating in this webinar. We know that you may have some questions after this meeting, so please contact us, and we want to hear from you. We also value your feedback and input. After the conclusion of this webinar, you're going to get a very, very brief questionnaire to share some insights on how this is working for you and what you need to help support CCM in your community. Please take a few minutes to fill those questions out. And again, we're always available to connect with you. Please feel free to email us at any time. Thank you for your time today.